We've made enormous progress in 2019 to transform the healthcare system, delivering better value and results for patients through competition and innovation using our 16 strategic initiatives. These accomplishments wouldn't be possible without our commitment to putting patients first. Strengthening Medicare. We're providing protection and improving Medicare to give seniors more choices and lower out-of-pocket expenses. We laid the groundwork to add 20 new procedures that can be provided in the hospital outpatient setting. We've helped lower Medicare Advantage premiums by 23% and added 1,200 plan options since 2018. E-Medicare. For the first time in a decade, we launched a modernized and redesigned Medicare Plan Finder, which provides users with a mobile-friendly and easy-to-use design. We also launched our first app, What's Covered, that delivers accurate cost and coverage information on mobile devices, so users can quickly see whether Medicare covers an item or service. My Health eData. Through Blue Button 2.0, beneficiaries can securely connect their data to apps and other tools developed by innovative companies. The apps can help them organize and share their claims data, find health plans, make care appointments, and check symptoms. 54 apps are already available in production, and over 2,400 developers from 1,456 organizations are developing applications. Sharing data is also at the heart of the Data at the Point of Care pilot. This makes Medicare A, B, and/or D patient claims data available directly to providers to help with treatment decisions. We took another landmark step forward in ensuring that patients have access to their health information, with proposals outlined in the Interoperability and Patient Access Rule. Transforming Medicaid. CMS unleashed data to enhance innovation in state programs and improve outcomes for children and adults with Medicaid. For the first time, we released Transformed Medicaid Statistical Information System data, what we call TMSIS. Now, researchers and others can access reliable information about Medicaid and CHIP enrollment, services, and payment. We released an updated Medicaid and CHIP scorecard, an innovative public-facing federal dashboard that includes additional data points, measures, and enhanced functionality. And we produced the first-ever substance use data book with information about diagnosis and treatment. These and other efforts help to ensure that states have the flexibility to best serve their residents. Fighting the opioid crisis. The introduction of new Medicare Part D opioid safety policies reduces prescription opioid misuse while preserving medically necessary access to these medications. We're also working to increase the number of Medicaid providers who can deliver treatment and recovery services in 15 states through $47.5 million in planning grants. Rethinking rural health. CMS now pays for patients to check in with their provider by phone and send videos or images to help them make informed medical decisions. This is especially helpful in rural communities. We finalized policies that will increase payment to hospitals located in low-wage areas, including many rural hospitals, so they can improve what they pay their hospital employees, maintain their healthcare labor force, and ensure patients have access to high-quality, affordable healthcare. Marketplace choice and affordability. With the Departments of Labor and Treasury, we issued a rule that allows employers to offer health reimbursement arrangements, giving millions of American workers more options for health insurance coverage. For the second year in a row, average benchmark premiums in the health insurance marketplace declined, this year by 4%, while the number of issuers participating in the marketplace increased by 20. Since 2017, 12 Section 1332 waivers have been approved authorizing state reinsurance programs to lower premiums, ranging from an estimated 6% reduction in Rhode Island to a 30% reduction in Maryland. Protecting taxpayer dollars. As a result of the President's Medicare executive order, we are implementing program integrity changes to eliminate waste, fraud, and abuse through prior authorization for 5 groups of procedures that can be considered cosmetic. We've seen improper payment decreases in the billions in a variety of Medicare fee-for-service areas, including home health, Part B, and durable medical equipment. And we also strengthened case coordination with law enforcement agencies to better crack down on fraud. Our coordination on bogus back brace claims alone identified $1.2 billion in losses and resulted in a significant decrease in billings. and we prevented between $5 and $23 billion in fraud through the Medicare Card Address Validation Project. Ensuring safety and quality. The 5-part nursing home strategy is improving care delivered in 15,000 nursing homes nationwide and streamlining expectations for the 70,000 inspections performed each year. We eliminated 79 measures across quality payment programs through the Meaningful Measures Initiative, resulted in projected savings of $128 million and an anticipated reduction of 3.3 million burden hours. In addition, through the Omnibus Burden Reduction Rule, we implemented changes to save providers an estimated 4.4 million hours of time previously spent on paperwork, with an overall projected savings to providers of $800 million annually. Innovative payment models. We realigned incentives and developed 12 new innovative payment models, so reimbursement is tied to value rather than volume of services. We revamped the Medicare shared savings programs under Pathways to Success to put ACOs on a quicker path to taking on real risk. By January 2020, almost 34% of ACOs will be on the path to take on risk, well more than expected in the first year. This trend is one of the reasons that the greater accountability for ACOs included in Pathways to Success, along with greater flexibility for them to innovate, will lead to better, more efficient care for people with Medicare. An executive order from the President made way for the Kidney Care Choice Model and the proposed ESRD Treatment Choices Model. These add financial incentives for providers to manage care for Medicare beneficiaries, to delay the onset of dialysis and incentivize kidney transplantation. Patients over paperwork. As a result of another presidential executive order, we are changing regulations to eliminate burdensome Medicare program requirements. This will result in reducing the level of burden on physicians and other healthcare providers. The medical community saved an estimated $6.6 billion, with a reduction of 42 million burden hours through 2021. Price transparency. For the first time, we're requiring the display of the 5-star quality rating system nationwide for marketplace health plans to offer consumers more information to help them compare plans. We also finalized policies that make hospital prices more transparent and proposed additional policies that would expand transparency to all healthcare prices, so patients are more informed about costs. Better care for dual eligibles. We provided more opportunities for states to test approaches to serving dually eligible individuals that work best for their state. We also modernized the programs of all-inclusive care for the elderly with a fully integrated model of managed care service delivery for the frail elderly, most of whom are dually eligible beneficiaries. Fostering innovation. We're now covering the FDA-approved chimeric antigen receptor T-cell, or CAR T-cell therapy cancer treatment that uses a patient's own genetically modified immune cells to fight disease to treat some people with specific types of cancer. We also took rapid action to combat antimicrobial resistance and secure access to life-saving new antibiotic drugs for American seniors by removing several financial disincentives and setting policies to reduce inappropriate use. Lowering drug prices. For the third year in a row, the average basic premium for Medicare Part D prescription drug plans is projected to decline. Over the past 3 years, average Part D basic premiums have decreased by 13.5%, saving beneficiaries about $1.9 billion in premium costs over that time. Modernizing CMS. We implemented an agency reorganization that better aligns our work with our strategic initiatives and removes structural barriers to fully integrate staff into one CMS. In addition, we're making progress on improving several processes that people told us they care about, things like making the regulations clearance process clearer and less manual, and reducing by more than 20 days the time to complete competitive hiring. These accomplishments represent only the tip of a large iceberg. The full list of major accomplishments we've been able to move forward this year are far too many to highlight in a short video. You can find more information about these and other ways we're transforming healthcare at cms.gov. And 2020 promises to be just as productive and inspiring as we remain committed to driving better value and better care for all Americans.